It's already been a really inspiring day, actually, and I think I've been taking pictures of every poster that everyone's got, and there are so many things that I'm going to take back, and to just get this award as well, it's just like such a surprise and really great. So thank you for doing that. So, oh no, the other way.
The other way, yes.
So I'm Carol Dale, the Head of Patient Experience at Central London Community Healthcare Trust, which is nominally based in the middle of London. So we provide community services to Hammersmith and Fulham, Kensington and Chelsea, Westminster, but also up in Edgware, Finchley, Barnet. And as of April, we'll be kind of moving into Merton, which makes the name Central London sound a little bit wrong at this point, but that's what's happening. So to run a Complaints and PALS team for that kind of organisation, we don't have a PALS office. We don't have somewhere that people can pop into. It's all about email and the telephone. So the skills you need are you need to be able to do long distance, and thank goodness my team are fantastic at doing that. So we're kind of a large service. We're probably one of the biggest community services in London, and we probably have about 60,000 contacts a month. So it's quite big. But I particularly want to tell you about the team, I'd like to say it was all my idea, but it wasn't. There was a particular manager that I used to work with called Tony Pritchard, and we came together again in CLCH, and this was always our dream to have this particular model of Complaints and PALS team. So this is the first year of making it work, really. But it's about celebrating the work of a team that's kind of come together in this new model, and bringing together all aspects of patient experience. So because we measure everything, I thought I'd tell you what we measure and what we do. So key targets for Complaints and PALS. So we have a 5-day turnaround target for any PALS queries, and we're kind of meeting that consistently, I think, mostly every month. And 25 days for formal complaints. And Kaylee is the formal complaints manager here, and we meet that. I've been meeting that 100% for last year. The whole of last year. Yeah. So that's amazing work, really. But because the team does all the other bits of patient experience, we also run listening events. So in February, May and November, we ran different listening events in different boroughs. But in November, because young people very rarely come to listening events, we went out to all the children's services. So we went to schools and health visiting clinics, lots of different young people's services, just to hear what the service was like for them. And we were particularly interested in how they wanted to be communicated with, so whether or not they would prefer text messaging or emails and things like that. And email won out of all of that, actually, rather than text messaging. But so we also run service improvement training programs in the Community Trust, and so we've managed to kind of bring patient experience into those training sessions. So we have patient representatives that go on the training sessions, but we also provide all the data that we already have. So if they're looking at improving district nursing services, then we'll provide them with all the data we've got around district nursing to help them. And we've got care certificate programs, which we usually get patients to come and talk about tell their story, so that people can hear what it's like to be a patient in our services. So we have experience measures, so we run surveys and the Friends and Family Test, and all our services do that. We've started doing dynamic patient story collections, so where people have communication barriers or difficulties, trying to find different ways of actually collecting their patient stories. And there's a particular story that's where a guy had a stroke at a very young age, and he'd started to use photography to tell his story. But instead of that just being about telling his story, he then started using photography in his daily life. So where he used to go home and tell his mum about what he'd been doing every day through the story kind of photographs. So it was lovely. So it's kind of a two win-win situation. We also run 15-step challenge visits, so you're probably all aware about those anyway. So we do those every month, so you go in as the eyes and ears of a patient, and Coordinating the executive team to join us is probably the hardest challenge. Our patients are much more available than the executive team sometimes. And we've just trained some of our team to start running Schwartz rounds in the trust, and we've rolled out the friends and family test everywhere. So those are the things that we've kind of measured and can say that we've done. But more than anything, it's about this developing a patient experience facilitator role. So it's slightly different to how we normally run things. So the patient experience facilitator has a responsibility for the patient experience for their division. So we're split into 4 divisions. So we have 4 facilitators. But at the same time, they manage the PAL service. So they do a 1 in 4 rota of running the PAL service, and they're all Band 6 staff. So it's about getting good skilled staff to be at the end of those phones, really, which is what we're aiming for. So this role is about learning from complaints and early resolution. So wherever possible, we try to make sure. So the PALS team sit right opposite the complaints team. So if there's any doubt, we can say, what do you think is, do we need to kind of go down a formal route? Does the patient want to do that? Does the carer want to do that? But there's a lot of discussion. But wherever possible, we try and resolve it as quickly as possible and get a solution from the service. A richer staff experience and engagement. It's a challenging role, I have to say, and managing the conflicts of managing PALs and other work is quite difficult, but at the same time it's quite stretching, and so the patient experience facilitators kind of get a rounded experience rather than just doing one of those roles. So skilled communicators on the end of the telephone is really important to us. It's their first point of contact sometimes with the PAL service. But also the facilitators have a real ear to the ground, so you can ask them at any time what's happening in the services, and they'll say, well, I can tell you now. And we know when a letter's gone out, and we know when something's happened, and we know if there's a delay in getting appointments. You know everything that's happening because of the PALS link. And I think sometimes that gets a bit missed if you're working just in patient experience. So bringing the feedback all together, so each of the facilitators works to produce a report for each division on everything that's happening, and we're trying to just get better and better at that, really. It's a work in progress. I'm sure the iterations will keep going, really. And development of divisional expertise, so we're really trying to get the divisions to feel confident about patient experience. So that's the kind of facilitator role. And these are kind of just links. I thought I'd try and be clever and link things to the leadership framework and just see where it fitted with that. But I'm watching my clock, so I don't think I've got time to really go into it very much. So this is the team and what it looks like. So that's me, and then we've got 4 patient experience facilitators. Kaylee, who's the complaints and claims manager, and we've got a customer service officer. And I also manage the volunteers, which is great because the volunteers are so supportive of improving patient experience. So they often are out there collecting patient experience feedback and just helping at meal times, things like that. So that really, really helps us, and it brings that all together in the same piece, really. So this is the team and how it's kind of split up. So there's different divisions, 4 different divisions, 4 different facilitators. One has the lead role for across the trust, the whole trust, for PREMs, friends and family tests, and accessible surveys, so surveys for children and young people, people with learning disabilities. And that person manages the contract with PICA, which I love working with PICA, they're just amazing. Next person leads on patient stories across the trust and those dynamic stories that I was talking about. And we have an internal patient experience group, which is an operational group to get everything kind of moving and keeping it moving. Then we have a children's division, and that person leads on the 15-step challenges, Schwartz rounds, and coordinates all our team meetings, which we usually meet once a month, but sometimes we meet in between times as well. And then the fourth leads on patient engagement, so the listening events I was talking about. But this year we're really focusing on the carers strategy and engaging with carers, really, and the quality stakeholder reference group. So these are just, we like to measure things. I think this was the number of complaints. Cut off the title there for some reason. This is the response rate to complaints. This is the number of PALs that we get. And this is that's the complaints response, isn't it? Sorry. Look at Kaylee. No, excuse me. I think that's mine. So just thinking about next year, those are the things we're hoping to achieve next year. But the things that make it work, I think, are about making sure the job description's right, making sure the teams work really closely together, co-location if possible, developing materials for the staff to be confident, and we've really developed the processes really in the last year to make sure that everyone's following the same kind of processes. And the rest kind of speaks for itself. But thank you very much.